Quality of care for the Alfred is a fundamental part of what we try and deliver. So as much as we have a responsibility for financial balance, actually the quality of service of what we offer is really very, very important. So we have a number of initiatives running at any one time that help us understand both how patients and their visitors and relatives see our services. I guess our most noticeable area is the access waiting times. So we've spent a lot of the last year or so improving and reducing the length of time people wait for access to our services, be that in the emergency department or waiting for surgery. Those are now very acceptable from the board's perspective, but we're moving more and more into what we would call clinical quality areas. So things like improving infection control rates, reducing the likelihood that while you're in hospital you'll get an infection from somebody else or from one of our staff, reducing the risk that you might fall while you're getting out of bed or whether you're transferring, so reducing that sort of area is really important for patients. And then we're moving into other things about how we manage processes, so reducing the number of steps that patients take in order to get through some of our administrative processes. So I'm endlessly impressed by the amount of attention to detail that our staff give to quality of care. Every day I go around the organisation and find new things that people have done to improve the experience of patients and to improve the quality of care that they provide. That might range from contacting a relative to let them know something different is happening with their patient relative, or it might be a particular way of trying to deal with a problem that a ward is facing with a clinical issue. But every day there's something new happens and our staff are amazing in that piece of work. So the innovation of bringing a DVD into the way in which our quality of care report can be read is, I hope, an innovation that helps consumers, patients, people who are interested in what we do understand in a different way from the report those things that we think we have seen an improvement in this year. So the report stands alone, but the DVD should just help give a little bit more detail and perhaps bring some of those issues to life for people who want to have a look and see what we've been up to.